Dr. AstraZeneca and international regulators, they say there's no evidence that the shot is to blame for the blood clots. But as Lucy reported, we know several countries in the EU have banned it. Do you believe that the AstraZeneca vaccine is safe?
Well, I think based on the report that Lucy also just mentioned, the numbers are too low to get really excited about. There has been about 17 million doses that have been distributed, and only 37 patients have had some form of either DVT or superficial blood clots. And it's hard to know exactly what the cause of this. Given the numbers, I think this is way too small to really be nervous about this. I think the public they are concerned because the speed of the development of these vaccines were in a short period of time. But I think this is going to be a big blow to the whole distribution and the mission, especially in Europe. Don't forget, people talk about socialized medicine and the healthcare system that they have in Europe and the bureaucracy. It's way, way worse than what we have in U.S. We've been successful in America because we have had over 100 million vaccines that are giving out. Now we're at 2 million vaccines a day. And we have about 37 to 40 million people that have completed full vaccination, as opposed to Europe. The dosage, as you heard from Pfizer and Moderna, is low, and this is going to be a major blow to their mission. So I'm concerned. I think the benefit of getting this vaccine outweighs the risk of some of the complications they're talking about. So I think they should really think about this twice before they pull the plug on AstraZeneca.
All right, so that's happening across seas. Let's talk about here in the United States, where we've learned just moments ago that Moderna has actually begun studying the effects of its vaccine on children. As we know, and we've talked about, children are rarely affected by the virus, at least seriously so. Would you recommend that children get this vaccine?
I really don't see the data behind this. As we've talked about for the last 6 months, children are, for some reason, they're immune to this virus. The risk of dying, if they don't have any comorbid disease, is extremely low. Passing it on to others and also dying from this is very low. So I don't see a huge benefit of giving vaccines to the children today. We need to see what happens in the future. But I think we should, for the people that are open to it and they have risk factors, certainly over the age of 65 with comorbid disease, they should get the vaccine. And again, the benefit outweighs the risk at this moment. Don't forget, we also are dealing with some variants, the B.1.1.7, and we think that these vaccines still have coverage for those variants, but that remains to be seen. So vaccine is helpful, especially in nursing home, elderly, and people with comorbid disease.
Believe it or not, today, Doctor, marks the 1 year since the country went into lockdown for the first time. Again, those 15 days to slow the spread. Here's actually the original graphic that was put out by the White House. Over this year, these 365 days, Doctor, I just want to know what you think Americans got right about the coronavirus and our response and reaction to it, and perhaps what was incorrect.
Well, I think we did a lot of great things. You have to understand that this is a virus that was completely unknown to America. We had no clue who he was going after, and this was a major attack on the American healthcare system. It's time to recognize, 1 year after, a major credit to our doctors and nurses and the hospitals across this country. I'm so proud of all of my colleagues who spent hours and hours, and so many lives were saved. Was it perfect? Of course not. Just like any other pandemic, there's always looking back and say we should have done a lot of things different. One thing that was for sure, and you saw me in my tweets hundreds of times, that these repeated lockdowns was devastating. And the complication and side effects from these lockdowns were much worse than the benefit. The initial lockdown, just to buy some time to find out what's going on, to get our act together and get our supplies up and running, that was justified. But this second and third and 50th lockdown across the country was, in my opinion, was a big mistake. A year back, I think I'm talking to a lot of my patients, it puts a different perspective in life. You appreciate little things that we took for granted. We need to be a better country, a stronger country. And the lesson that I learned is to be independent in our country when it comes to healthcare. Don't count on China and other people to give us our ventilators, our antibiotics, our medications. America is the best and the strongest healthcare system in the world, and it's time to really lead and bring our supplies in this country for national security than every other reason.
Yeah, some really important and